Welcome to vpod.ai and welcome everyone to the deep dive. Today we're taking a close look at, well, a really critical and often quite silent health challenge, liver cancer. Now, it's a disease that for many people still carries a lot of fear, but our goal today, our mission, is really to show you the incredible progress being made, progress in understanding it and diagnosing it, and crucially in treating it. We really want you to finish this deep dive feeling not just, informed, but truly empowered with that knowledge. But before we really get started, this deep dive is sponsored by StoneFly. They're your trusted solution provider and advisor in enterprise storage, backup disaster recovery, hyperconverged VMware, Hyper-V, Proxmox cluster, AI servers, SA365, which is a turnkey security appliance, plus public and private cloud. You can check out stonefly.com for more info on all that. Okay, so to really get a handle on liver cancer, we have to start with the liver itself. It's this amazing multitasking powerhouse in the body, constantly filtering blood, processing nutrients. It even helps with blood clotting. So what actually happens when cancer strikes an organ that's just so central to, well, so many different functions?
Yeah, it's like a ripple effect, really.
Uh,
Beyond everything you just mentioned, the liver makes bile, right, which is critical for digesting fats. And it handles sugar for energy, keeps our blood sugar balanced. And something many people don't realize is its role in generating lymph. That's a fluid absolutely vital for hydrating our cells and for our immune defense. So when those liver cells become cancerous, they just start multiplying, uncontrollably. They essentially crowd out the normal healthy cells. And this uncontrolled growth, it really impairs the liver's ability to do all those vital jobs.
Huh.
A classic sign of this impairment is jaundice, the yellowing of skin and eyes. That happens because a healthy liver filters out bilirubin, but a diseased one just, well, it can't keep up. And it's also really crucial to distinguish between primary liver cancer, that's cancer starting in the liver, and secondary metastatic cancer. That means cancer is spread to the liver from somewhere else, like, say, colorectal cancer, breast, or lung cancer.
That is a critical difference. So focusing on primary liver cancer, the kind that actually begins in the liver, what are the main types we're usually talking about? Is one much more common?
Absolutely. By far, the most common type of primary liver cancer is hepatocellular carcinoma, HCC for short. That's what we'll mostly focus on, really, because it makes up the vast majority of cases. But you do have other types. They're much rarer, though. Things like intrahepatic cholangiocarcinoma, which starts in the bile ducts inside the liver, or angiosarcoma, that's an extremely rare one, starting in the liver's blood vessels. And then there's hepatoblastoma, which you almost always see in very young children, usually kids under 2.
Right. And here's something that might be surprising, maybe even a bit reassuring for someone who's just gotten a diagnosis. A lot of growths found in the liver aren't actually cancer.
That's exactly right. Things like hemangiomas, those are just the collections of blood vessels, or hepatic adenomas, and focal nodular hyperplasia. These are all benign, non-cancerous. And what's important for you to know is that these often don't need any treatment at all, which, can be a huge relief when something abnormal is first spotted. It really shows why careful diagnosis is just so important. Now, what's truly illuminating about liver cancer, especially HCC, is how strongly it's linked to underlying liver damage. Cirrhosis, which is basically irreversible scarring of the liver, isn't just a risk factor. Often, it's the main gateway to developing HCC. And the scarring process itself, well, it can come from different chronic conditions. Globally, chronic viral hepatitis, specifically hepatitis B and C, are huge drivers. Heavy long-term alcohol use is another major one. And increasingly, we're seeing non-alcoholic fatty liver disease, or NAFLD, sometimes called MFSLD now. It can progress to a more severe inflammatory form, MANISH or NASH, leading to cirrhosis and definitely bumping up that cancer risk.
So it sounds like it's often a long-term thing where damage just builds up over time and sets the stage. Beyond cirrhosis, what other factors play a role? I think you mentioned things like excess weight and maybe even demographics.
Precisely. Yeah, beyond those main causes of cirrhosis, other things add to the risk profile. Heavy alcohol use is a risk factor in itself, even separate from causing cirrhosis. Same goes for tobacco use. Excess body weight is a big concern, often tied to that metabolic dysfunction-associated liver disease, MASLD, and then cirrhosis down the line. Type 2 diabetes is also identified as a risk factor, often, working together with other risks. Age is a factor too. The risk generally goes up after 63, which kind of reflects that accumulation of liver damage over decades. Interestingly, it's also more common in men than women. And certain ethnic backgrounds, like Asian Americans and Pacific Islanders, tend to have higher rates, possibly linked to higher rates of hepatitis B. Then you have rarer conditions, like hereditary hemochromatosis, where the body stores too much iron, or exposure to certain toxins like aflatoxins. Those are fungal toxins you might find in, say, improperly stored peanuts or corn.
Okay, here's a really crucial point, and honestly a challenging one about liver cancer. It's often silent in the early stages. Many people, like that story of Jerry H.N. you mentioned, feel completely fine. His cancer was found totally by accident after a stroke. So when symptoms do finally show up, what might people notice, even if the symptoms seem kind of vague?
Right, when symptoms eventually surface, they can be quite varied and easily mistaken for other, less serious things, which makes diagnosis tricky. We're talking about things like persistent pain in the abdomen, maybe a feeling of bloating, unexplained fatigue that just won't go away, nausea, sometimes vomiting. And as we mentioned before, jaundice, that yellowing of the skin or eyes. The really insidious thing about these early stages just highlights why early detection is so important, especially for anyone with known risk factors. For instance, national guidelines actually recommend regular liver cancer screening, usually every 6 months, for patients who already have cirrhosis. This often involves a blood test for AFP, alpha-fetoprotein, that's a key cancer marker, combined with an ultrasound. Catching the cancer early, it dramatically improves the success rate of treatment. It makes potentially curative options much more likely.
Okay, so if a doctor suspects liver cancer, how do they actually confirm it and figure out the stage? What's that diagnostic journey usually look like? Is it mainly imaging or do they always need a biopsy?
It's usually a combination, like putting puzzle pieces together. The typical path relies heavily on imaging tests and specific blood tests first. Biopsies are definitely important for getting detailed info about the tumor, identifying specific mutations that can help guide personalized treatment. But they're generally kept for cases where the imaging isn't totally clear or when doctors absolutely need that tissue diagnosis.
And what kind of imaging tests are we talking about here? I know there are quite a few different types.
Yeah, to get those pictures inside the body, doctors use several advanced techniques. CT scans, especially what's called multiphasic CT, are really powerful. They use X-rays for detailed cross-sections. Often they use a contrast dye given at specific times. This helps show how tumors behave differently than healthy liver tissue. MRI scans, including dynamic MRI, give even more detail using radio waves and strong magnets. They're incredibly effective, but it's good for you to know about the strong magnets. Sometimes it's noisy, and some people feel claustrophobic, though things like mild sedatives or earplugs can definitely help with that. PET scans, often combined with CT scans, so PET-CT use a radioactive tracer. This tracer lights up areas with high metabolic activity, which can signal cancer. And then ultrasound using sound waves is still really valuable for initial checks or guiding procedures. It's painless too. Each test gives unique information.
Got it. So beyond those visual clues from imaging, blood tests sound absolutely critical for completing the picture. What key information do doctors get from blood tests when looking at liver cancer?
Oh, blood tests tell us a lot. We look at a complete blood count, the CBC, just to check overall blood health. Then a comprehensive metabolic panel gives us important info on kidney and liver function, really crucial for assessing baseline health before treatment. And, very importantly, specific liver function tests measure chemicals like albumin, bilirubin, and again, that alpha-fetoprotein or AFP, which can be elevated in HCC. Blood clotting tests are also vital because the liver makes those clotting factors. And a hepatitis panel is standard procedure to check for chronic infections like Hep B and C, which, as we discussed, are major risk factors.
And how do all these results, the imaging, the blood tests, help doctors figure out a patient's overall health and decide on the best treatment path?
They really paint the full picture. It's not just about diagnosis, but also about figuring out if someone is suitable for certain treatments. For instance, some of those measurements feed into something called the Child-Turcotte-Pugh class. It categorizes how severe the underlying liver disease is, class A, B, or C. This is crucial for surgical decisions because you need enough healthy liver function left to recover from surgery. There's also a performance status score, usually 0 to 4, which assesses how generally fit a patient is, their ability to handle daily activities. That directly influences treatment choices. And now, advanced tumor biomarker testing, like checking specific levels of AFP or another marker called CA19-9, and tumor mutation testing are essential. These tests really help personalize treatment plans by finding specific genetic mutations in the tumor that can be targeted with particular drugs. It makes treatment much more precise than it used to be.
That leads us perfectly into the really dynamic, constantly evolving world of liver cancer treatment. It's a field where, okay, maybe there isn't one single cure-all, but there are so many innovative options now. all aimed at reducing symptoms, extending life, and really improving quality of life. This definitely highlights the need for that multidisciplinary care team approach, right?
Absolutely, 100%. No single doctor makes all the calls. It's truly a team effort. You have oncologists, surgeons, interventional radiologists, radiation oncologists, liver specialists or hepatologists, palliative care specialists. They all collaborate to tailor the best plan for each individual person. Broadly, treatments fit into two main buckets. You've got local therapy, which targets a specific area like the tumor itself, and systemic drug therapy, which works throughout the whole body to hit cancer cells wherever they might be.
Okay, let's talk local therapy first. Surgery is often a key part of treatment. This might mean a partial hepatectomy, removing just the part of the liver with the tumor. What's really incredible here is the liver's almost like mythical ability to regrow. How does that affect surgery and recovery?
It is one of the most amazing things in biology, honestly. Even if a large part, maybe 50% of the liver is removed, the remaining tissue actually grows bigger, it undergoes hypertrophy, the cells get larger, and it matures pretty quickly, within weeks or months. Often it functions just as well as the original full-size liver. This unique regeneration lets surgeons be, well, more aggressive in removing tumors than they could be with other organs. And modern techniques, like minimally invasive laparoscopic or robotic surgery, are always improving this, helping cut down on complications and speed up recovery time.
That's just incredible. But sometimes removing part of the liver isn't enough, or maybe the liver itself is too damaged by cirrhosis. That's where liver transplants come into play, correct?
Yes, exactly. A liver transplant means replacing the entire diseased liver with a healthy one from a donor. This is often considered for patients with early-stage HCC, but who also have advanced cirrhosis, where their own liver just can't sustain them long-term, or when the tumor fits specific criteria. The United Network for Organ Sharing, UNOS, has pretty strict criteria for who's eligible. It includes limits on tumor size, like, say, one tumor no bigger than 5 centimeters, or maybe 2 or 3 tumors each under 3 centimeters, and specific AFP levels, too. They also use something called the MELD-C score model for end-stage liver disease, which measures how severe the liver dysfunction is to help prioritize people on the waiting list. And while waiting for that donor liver, patients might get what's called bridging therapy, things like ablation or embolization, maybe radiation, just to keep the cancer in check so it doesn't grow beyond the transplant criteria.
Right. Now here's where things get really interesting. These minimally invasive procedures, often grouped under interventional oncology, they sound incredibly precise. Can you walk us through how they target tumors without needing major surgery?
Yeah, these techniques are fantastic. They allow for really precise targeting of tumors, often meaning shorter hospital stays and quicker recovery, which is great. Think about tumor ablation. This uses either extreme heat from radiofrequency or microwave energy, or extreme cold, called cryosurgery, to basically destroy the tumor cells right where they are. This is often a good option for tumors that aren't suitable for regular surgery. Then you have embolization. This involves injecting materials directly into the arteries that feed the tumor. It could be chemoembolization, where tiny beads soaked in chemo drugs are used, or radioembolization, which delivers tiny radioactive pellets, like Y90, straight to the tumor. Both methods basically starve the cancer cells by cutting off their blood supply, and they do it while minimizing side effects to the rest of the body.
And what about radiation therapy? I know it's moved way beyond being just a blunt tool. It seems much more targeted now.
You're absolutely right. Radiation therapy has come a long, long way for liver cancer. Techniques like stereotactic body radiation therapy, or SBRT, can deliver very high, very precise doses of radiation right to the tumor in just a few treatment sessions, really protecting the healthy organs nearby. There's also MR-guided RT, which lets doctors see the tumor in real time during the radiation treatment, allowing for amazing accuracy. And proton therapy uses protons instead of the usual X-rays. The advantage is that protons deposit most of their energy right at the tumor site and have less exit dose, which further spares healthy tissues. This can lead to better outcomes with fewer side effects.
Okay, so beyond treatments aimed right at the liver, we have the systemic drug therapies, the ones that work throughout the body. These have really expanded the options, haven't they?
They really have. Chemotherapy still has a role. It uses powerful drugs to kill fast-growing cells like cancer cells, though its specific role in liver cancer has shifted a bit as more targeted options have come along. Then there's immunotherapy, which has been a true game changer. It basically re-energizes the body's own immune system to go after the cancer. Often these drugs work by blocking certain off switches on immune cells, things like PD-1 or CTLA-4, which lets the immune system better recognize and attack the cancer cells. And finally, targeted therapies, These are drugs specifically designed to interfere with particular molecules that cancer cells rely on to grow or spread. Examples include drugs like sorafenib or bevacizumab and its biosimilars. Those are almost identical versions made by different companies. These therapies are all about precision, hitting cancer's specific weak spots.
And speaking of cutting edge, I've heard about something called histotripsy. This sounds almost like science fiction. What exactly is it, and how does it work?
Histotripsy is very cutting edge, yeah. It's a robotic, totally non-invasive technology. It actually got FDA approval in 2023, specifically for liver tumors. It uses highly focused sound waves, ultrasound, actually to literally break apart the tumor tissue mechanically. It creates this sort of bubble cloud inside the tumor that pulverizes it. No surgery, no needles, no radiation involved. It offers a really promising new option, especially maybe in cases where other treatments aren't suitable because of where the tumor is or the patient's overall health. It's a big step forward in non-invasive tumor destruction.
Wow. So with all these incredible medical tools and advancements, what does this all mean for the patient experience beyond just the direct medical stuff? We often hear about the importance of, well, holistic care.
Exactly. And that's critical. Comprehensive nutrition guidelines, for example, are incredibly important, not just during treatment, but before and after too. The advice is usually pretty practical. Eat small, frequent meals to keep energy levels up and get consistent nutrients. Prioritize protein-rich foods. They help repair cells and support the immune system. Include whole grains for energy, and really aim for a wide variety of colorful fruits and vegetables for all those antioxidants and vitamins. Staying well hydrated is also key. And beyond what to eat, food safety is vital, especially if your immune system is weakened by treatment, sometimes called a neutropenic diet. It means being super careful about washing hands, avoiding raw or undercooked foods, unpasteurized dairy or juices, even some deli meats. And for some patients, maybe after certain surgeries, there might be even more specialized nutrition advice to help with digestion and recovery.
You know, these insights into care beyond the purely clinical really bring the human side into focus. Like Jerry Achan, who said his stroke was the luckiest day of my life because it led to finding his liver cancer early enough for successful treatment. Or Eric, who talked about keeping a positive attitude and finding a real sense of family with his care team. And Sally Hargroves, overcoming that intense fatigue after her surgery, finding such gratitude, and now cherishing time with her grandson. These stories really underline the power of patient advocacy and the huge value of support systems, like programs that connect current patients with survivors who've been through it.
Absolutely. And that holistic approach definitely includes palliative care. It's so important for people to understand that palliative care is an extra layer of support that should be available right from diagnosis. It's not just for end of life. The whole focus is on improving quality of life. That means proactively managing symptoms, things like pain, fatigue, that fluid buildup in the abdomen called ascites, nausea, anxiety. It also helps patients and their families navigate complex treatment decisions, coordinate care, and address all the emotional and social challenges that come with a serious diagnosis. It just ensures the journey is as comfortable and supported as possible.
Now, navigating all this, it's also really important to filter out the noise, right? Especially the misinformation online that often promises quick fixes. Which brings us to those claims you sometimes see about castor oil for liver health or even treating cancer. Is there any real science behind that?
Yeah, it's tempting, isn't it? Looks like a simple, easily accessible solution. But when it comes to medical claims, we have to rely on scientific evidence. Castor oil is FDA approved, yes, but only as a laxative. That's it. There's simply no scientific research, none to back up any of those claims you see online about it detoxifying the liver, helping with weight loss, or breaking up tumors. Trying to use it for these unproven things, especially while you're undergoing cancer treatment, can be unsafe. It's definitely ineffective for those purposes, and it could even irritate skin that might already be sensitive from radiation or other treatments. The absolute critical takeaway here is always talk to your care team before trying any unconventional therapies, especially during cancer treatment. Your body already has amazing natural detox systems, primarily your liver and kidneys. Focusing on a healthy lifestyle, good diet, exercise, enough sleep, that's the best detox strategy there is.
Wow, what an incredibly thorough deep dive we've had into liver cancer today. We've really covered a lot of ground from the liver's vital, often unsung functions and the different cancer types to those crucial risk factors and why it's often silent early on. We explored the whole diagnostic journey from high-tech imaging to those revealing blood tests, and we really got into the weeds on the innovative and diverse treatments available now, regenerative surgery, transplants, targeted therapies, precision radiation, and even that groundbreaking histotripsy.
Indeed. The progress in understanding and treating liver cancer is genuinely remarkable. I think our discussion really highlights the value of making informed decisions, the power of having that collaborative, multidisciplinary care team, and just how critical comprehensive support is.
Yeah.
Support that goes beyond just the medical side to include things like nutrition and palliative care. It really is about fighting the disease while also maintaining the best possible quality of life.
And as we wrap up, maybe let's leave you, our listener, with a final thought to mull over. Given the liver's absolutely incredible regenerative capacity, that unique ability it has to regrow even after big chunks are removed, what other medical breakthroughs might this unique biological trick unlock in the future? Maybe for therapies way beyond even cancer treatment as we currently know it. Before we sign off, we definitely want to thank StoneFly again for supporting this deep dive. And speaking of cutting-edge solutions, did you know StoneFly offers a 100 TB immutable and air-gapped SSO NAS for just $8,995? That's a really powerful solution for protecting your critical data. You can find out more at stonefly.com. Thank you so much for joining us on this deep dive. We hope you'll continue your own deep dives into topics that intrigue you and keep you informed. Until next time.